everyone and welcome back to my channel. In today's video, we will be discussing about all the systemic and the oral deficiency manifestations of the fat-soluble vitamins, that is vitamin A, D, E and K. So, let's get started. The deficiency of vitamin A, it will cause ocular manifestations and your dental or oral manifestations. So in your ocular manifestations, we will see night blindness, Wittauch spot, xerophthalmia and keratomalacia. Oral manifestations will include enamel hypoplasia, keratinization of oral mucosa that will lead to dry, rough and leathery mucosa, increased susceptibility to caries and your periodontal diseases, and impaired wound healing in oral cavity. So, excess, that is hypovitaminosis A, it will cause acute symptoms, that is headache, vomiting, bulging the frontale in infants. Chronic cases will see hepatosplenomegaly, bone pain, increased intracranial pressure. In your oral, we will see cracking of lips, gingival bleeding, mucosal ulceration in your most of the cases. Now over here we can see this is your enamel hypoplasia that is caused due to deficiency of your vitamin A. Over here we can see this white color debris that we see in your conjunctiva, that is nothing but your Wittauch spot. And this is your xerophthalmia. Okay, now we move to next, that is vitamin D. It is also called as calciferol. Now the deficiency, that is the systemic deficiency, will include in children we will see rickets, that is bow legs, pigeon chest, delayed closure of frontalis. In adults we will see osteomalacia, bone pain and fractures. In elderly we will see osteoporosis. Now the oral or the dental manifestations of vitamin D deficiency includes delayed eruption of teeth, enamel hypoplasia and dentine defects, hypocalcification, that is the tooth will become more prone to caries, periodontal diseases due to weak alveolar bone. Excess of vitamin D will cause the oral manifestation will include pulp calcification and enamel defects, and your systemic will include hypercalcemia, nausea, vomiting and many more symptoms. Now let us see the images. So over here this is your pigeon chest that we see in children due to the deficiency of vitamin D. Over here this is of osteomalacia, that is the weakened bone density is seen. In these images we can see over here the teeth have become more susceptible to caries, delayed eruption of teeth, then enamel hypoplasia. So all these features are due to deficiency of vitamin D. Next includes a vitamin E. It is also called as tocopherols. Now what are its systemic deficiency manifestations that we can see? It will lead to hemolytic anemia due to fragile RBCs. Neurological issues, that is peripheral neuropathy, ataxia and muscle weakness. And we can also see encephalomalacia. Encephalomalacia means your bulging and the softening of the brain tissues and reducing the dura mater in your brain. Oral and dental manifestations will include delayed wound healing. In severe cases, we can see atrophy of oral mucosa, increased susceptibility to periodontal disease. Now, excess of vitamin E will cause diarrhea, fatigue, blurred vision, and it may interfere with vitamin K metabolism that will increase the risk of bleeding. Now, what happens when vitamin E decreases in your body? Over here we can see this image, this is of encephalomalacia, that is the bulging of your brain matter. Over here, this portion is your atrophy of your oral mucosa. And it will include hair fall, eye problems, the patient will have anemia due to fragile RBCs, there will be hormonal imbalance and muscle weakness. Next is vitamin K deficiency. The systemic deficiency syndromes or symptoms includes, it leads to bleeding tendencies such as easy bruising, petechiae, hematoma and delayed clotting time. Post-translational modifications of 2, 7, 9 and 10 clotting factors. Oral manifestations include spontaneous gingival bleeding, prolonged bleeding after tooth extraction and hematoma in oral mucosa. If the deficiency is severe, even minor trauma during tooth brushing can lead to bleeding. Over here in this image we can see of an infant having the vitamin K deficiency. In adults, it will lead to bleeding. Even after a normal brushing of teeth, the adult will find that it has bleeding gums. The other symptoms include eating bruising, then over here increased risk of nosebleeds, blood in urine or stool, heavy menstrual bleeding in women, weakened bones, and oozing from cuts or wounds that takes longer to stop. So with this, we have completed the manifestations that are seen due to deficiency of fat-soluble vitamins. In our part 2 of this series, we will understand the systemic and the oral manifestations that are seen due to deficiency of water-soluble vitamins, that is vitamin B complex and vitamin C. Thank you. Subscribe and share for more such videos.